came in here is the same area that was involved.
Really?
Yes. Same area on that left side. Oh.
See, now the left side,
Put blue.
they said that they didn't know if it was a plaque or blood that was clogging it. So they kept him on the aspirin. They said that will take care of a blood clot. And then when he went back on his blood thinner just a week ago.
I know, that's what I was told. That was Xarelto, right?
Yes.
Okay. So, here's what I think happened, okay? I think you had the stroke. You have a history of atrial fibrillation.
Yes.
Okay? And I think that is probably what caused your stroke to begin with back in June, okay? I also looked at the blood vessel studies you had back done in June as well, and it did look like that artery that went to that part of the brain where you had the stroke was blocked, okay?
Right.
And at that point in time, after someone has a stroke, if it's depending on the size of it, we try to slowly introduce those blood thinners back into the system because there's a risk of what we call bleeding into that area of stroke.
Okay.
So typically the guidelines would recommend 7 to 14 days. You put them on aspirin and then you can put them back on a potent blood thinner like Xarelto in 7 to 14 days, which it sounds like they did.
That's what it did, yeah.
However, there are some cases where you have to wait longer. And
that
that is very hard to predict because the guidelines say usually 7 to 14 days. But now that he's had this slight increase of bleeding in that region where he had his stroke, we unfortunately have to hold the Xarelto even longer.
Okay.
I would say probably 14 to 21 more days.
Okay.
And then likely we'll be able to resume at that point in time because he will need to be on a blood thinner long term to decrease his risk of stroke. Aspirin is not going to fully reduce his risk. It will give him protection, but it's not the best medicine to reduce his risk of another stroke in the setting of atrial fibrillation. However, weighing the risk and benefit, you also don't want to put him on it sooner because bleeding will occur.
Absolutely.
And that's where we're at. We're at a double-edged sword, a little bit of a catch-22, but when they called me in the ER
last night. This doctor had no
night,
way of knowing. He just was doing.
this doctor had no idea of knowing
Right.
in the ER last night. He just said, oh my gosh, the CT looks like there's an evolving stroke and he's got a little bit of blood. So he called me, I said, let's admit him. But then when I heard that there was a history of stroke and recent Xarelto, I said, let me wait to see if I can get those records. Sure enough, I can see them now.
Okay.
The strokes that he had in North Carolina were in the same exact areas where the area that we're seeing on CAT scan now.
Okay.
Not a different part of the brain.
Okay.
So that's good.
That's good. Yes, yes.
We
please.
just unfortunately
Yes.
dealt with a little bit of that bleeding in there, okay? And that's probably because of the Xarelto that was reintroduced. Not that it was wrongly reintroduced, it's just, it's hard to predict who's gonna be able to start in 7 to 14 days and who's not.
Right.
And sometimes you don't know.
Well, he's going back in for blood work in next week, I believe it is, to this doctor, to his primary doctor.
North Carolina?
Yeah.
Okay.
He hasn't come in for blood work.
Let me just make sure this isn't the
Okay, that's
emergency
fine.
department.
Yes, yes.
Hello, it's Dr. Maddie. Okay. Hello? Yes. Yes. Yeah. No, just a repeat non-com head CT. That's it. Yep, bye. Okay, sorry.
That's okay.
There's only one of me for the whole hospital, so I have to
That's
answer them when they call.
Perfectly all right.
So he came, so they're gonna do blood work, it sounds like, additional blood work when they
Yes,
go
that's
up
what
there.
they did, yeah. That's what-
I think this is probably more from his AFib, honestly. It's a very common cause of stroke in individuals, and when they're, was he on a blood thinner before he had that stroke?
No, he stopped taking the blood.
He didn't, he
That's
couldn't
what
afford
caused
it.
the stroke.
Yeah, so why did he stop taking the blood thinner?
Because he said he couldn't afford it. It was too much money. He doesn't need it. Yeah.
But there's a lot of different types of ones that are cost effective.
Yeah, we got this taken care of
You
now.
got that squared.
Yeah.
Okay.
It ain't gonna happen again.
Yeah, so that's actually supports the idea that the AFib is what caused the stroke
Right.
too, because when he came off of it, he had the stroke.
Yeah, he came off it on his own accord, not that.
Yeah, it's usually men are stubborn, I'll admit
Yes, they
that,
are.
and we tend to do our own sort of thing. So I agree with you on that. Either way, so from my standpoint, you know, the scan, the repeat CAT scan that was done looks stable. I don't see any worsening of bleeding from yesterday when he came in.
Okay, great.
So that looks very good. But
Okay.
the next thing would be to really wait to start that blood thinner again, probably for at least
Absolutely,
another 14 to 21 days.
I mean, he was doing great when he was just on the aspirin, the low dose aspirin. He was doing great.
Yeah.
And then when he went back on that blood thinner, then he started acting a little off balance every now and then.
Yeah. So
now that I'm putting everything together, it really did.
Yeah, I think
after
that's where
that
we're
blood
at.
thinner.
So I would be okay with him going back on a baby aspirin at this point.
Okay. Well, his doctor told him to keep taking the baby aspirin and the blood thinner. His doctor said let him keep taking the low dose and let's put him back on the blood thinner.
Be careful with that too.
That's what his sisters and everybody.
Well, since I can see their records, they're going to be able to see mine.
Okay.
Okay. So either way, I'm going to recommend that we essentially just do the baby aspirin.
Baby aspirin. Yeah, I'm down with that. Sure.
And so usually I like to wait 24 hours before it's fully reintroduced. So probably what we'll end up doing is we'll get him out of the ICU today.
Okay.
I'll probably get one more CAT scan. If it remains stable,
absolutely,
then we're going to put him back on his aspirin. And honestly, at that point, depending on what his rehab needs will be, he'll probably be able to go.
He was taking care of himself before this. The only thing is, he has aphasia.
Yeah. So that's that area of the brain.
That's right. We've been working on that, going to speech therapy. But as far as bathing and taking care of himself, he has been doing just fine.
So what happened yesterday that brought him in?
I was in North Carolina's beach.
I was there. We were having a celebration for birthday celebration, and he was sitting there, and he was. He didn't look good, and his face was really, really red. So my sister took his blood pressure, and it was fine, and she took his temperature, and it was okay. But his face just kept getting redder. Yeah.
And I said, did you check his
blood sugar? And it was 175. And then my sister said he had a headache, and he said he'd had it since the night before.
Yeah. And I gave him to a leave before he left to come to here, because we didn't sleep very well the night before. I had a headache from my lack of sleep. Because I even asked the doctor, I said, every time he has a headache, am I to assume he's having a stroke? And they said, well, that headache's going to last a while because of where the stroke happened.
Absolutely. Usually that stuff will calm down within 4 to 6 weeks after a stroke like this in that part of the brain.
Okay, it's been about 4 to 6 weeks, hasn't
it? But now he bled into it. So that's the other issue. So
he hasn't complained about a headache for so long that
But today he keeps doing that,
Well, actually, it's calmed down. Look, it's flattened out. It was a little higher a minute ago. It's like a stress bubble.
Yeah, I'll take a look at him and see where we're at. But that's going to be my Rex at this point. And then obviously he'll need close follow-up with his doctors back.
Absolutely, yeah.
Hello, sir. How you doing? Yeah? Can you tell me your name? What's your date of birth? Who are these lovely people sitting next to you?
Yeah, he met me, babe. Oh, okay.
Who's here? Do you know who's here in the room with you?
27.
Okay. Now, obviously, he's had some issues with the right eye. I see that.
That was when he was a kid. He hit himself with a knife in the eye, butter knife. Mama said he was trying to cut a rope or something.
Open your mouth. Stick your tongue out.
We just brushed his teeth, probably had toothpaste on it.
You got Parkinson's too. So
yes, he does.
Resting tremor here on the right.
Yes, he takes Obidoba.
Yeah. Can you pull me in? Carbidopa need to do it.
See, he even liked the way I said it.
I know. Can you lift your leg up? How about this one? And lift up your left. How about your other one? There you go. And how about your left arm? Can you lift up your left arm? There you go. Can you squeeze my hand? Can you pull me in? Push me away? Good. Can you say today is a sunny day? Say today is a sunny day. Can you show me 2 fingers? Show me 2 fingers.
2 fingers.
22nd.
Yeah, so this is the aphasia I'm just
2
testing.
fingers is 22nd. Right.
Can you give me a thumbs up?
2.
Can you do this?
2.
So he mimics. So he'll mimic me with different things. So that's part of the aphasia that we're seeing here essentially. He has a mixed aphasia where he has trouble expressing and a little bit of trouble with reception, obviously.
Yes.
So, and again, the best stroke recovery typically occurs in the first 3 to 6 months, not days and not weeks. So you have a long road to recovery here, but we got to let everything calm down, okay? So I'll talk with the hospital doctors here. I would imagine he's going to get transferred to the floor today.
You think he traveled too soon? I mean, would that
No.
have brought this on? No?
I don't think so. I think just
All right.
sometimes it's the introduction of the anticoagulant
Like you
again.
said, maybe should have been about the blood.
Yeah,
thinners.
no, I don't think it had to do with the traveling, but either way, we're gonna get him squared away while he's here, okay?
Okay, thank you very
And
much.
we'll repeat one more CAT scan probably in 24 hours, and then I would anticipate it if it's stable, we'll start him back on aspirin, and he'll be able to go back to North Carolina at that point.
Will he go home
Yeah,
or
will
will
I
he go
have
to
to
the
drive
hospital?
him or will he be
Well, it's gonna
transported?
depend.
Or?
We'll have our therapist look at him for rehab, but since I imagine he's already had extensive rehab evals at the other facility,
Yeah.
he probably already has the things that he needs for
Oh,
rehab.
yeah.
So it will likely be, yes, you will likely be able to
Okay,
drive him back
okay.
there, yes, absolutely.
All right.
Okay?
Can I ask you something?
Yeah.
He's been coughing a lot since this
Yeah.
happened, not before.
So we'll have to look at his chest x-ray. I'll leave that to the medicine doctors
Okay.
here.
All
We'll
right.
see if there's any sort of underlying pneumonia. We also have to make sure that he can swallow okay. So we'll have our therapist look at him, okay?
And he hasn't
Drinking water
eaten.
and everything.
But he hasn't eaten since yesterday morning.
Yeah, that's something. The speech therapist from Rocky Mount said no straws.
Yeah.
It was put on his thing about no straws, because every time he drinks, it goes down. He showed me a thing.
Yeah,
When you get
it
this
goes
thing,
down the wrong pipe.
yeah, and that causes his little cough every now
Yeah,
and then.
so we gotta be careful
So
he's
they
not.
took him off the straws in North Carolina, but I was just wondering if that's.
Yeah, let's have our speech therapist evaluate him again and see what they
So
say.
far so far he was doing fine.
Yeah.
But I can give it to meds with applesauce.
Yeah, that's fine. I'm fine with that. Yeah, I just while he's here, we'll at least have them check his swallow while he's
Yeah,
here,
sure,
just
sure.
to make
Okay.
sure. But in the interim, I'm okay with applesauce and his meds. and things
Yeah, I
like
mean,
that.
I appreciate that. I was just wondering,
Yeah.
because the cough is what they were concerned about too, and that's
Right.
what they came up with.
So we'll
so.
keep an eye on him. We're gonna keep his Parkinson's stuff going the way it is.
Excuse me.
Other than that, that's it at the moment. Okay.
Will he
So,
be able to eat today?
I would imagine so.
Yeah.
I would
He
imagine
stays
so.
awake long enough.
Okay.
Yeah. All right.
Can I put him on like
Diabetic diet
Let's
or?
have speech make that assessment first, and
They
then
won't do it.
they won't be able to get to him at the moment. So
Not
we can
today.
try. We can try a soft, but just watch him closely. If he has trouble with it, yeah, diabetic soft, and then just if he has trouble with, just stop it. Okay. So
Is
we'll
he gonna be on
try.
a heart healthy diet or
Yeah.
a diabetic diet?
Diabetic.
Where are we going? Okay.
Diabetic.
Thank you,
Diabetic.
Which
Doctor.
is a heart healthy.
Okay.
Yes. Pleasure meeting you.
You too. Thank you very much.
You're
Thank
welcome.
you. Thank you so
Okay,
much.
Pleasure
Thank
meeting you. Take care. Unfortunately, this wasn't your plan to come to Mary Washington
No,
on your trip
no.
down here, but you're here.
Yes, it's very nice.
Okay, take care.
Big hospital. Thank you.